happy to welcome Dr. Mark Adams. He's the Chief Medical Officer for El Camino. And
okay, hello everyone. Great to be here. Hope everyone's enjoying the balmy Bay Area weather today. So, can you hear me okay? Everybody? Okay, great. Well, listen, I'm going to talk to you about healthy reopening. Exciting to do that. I think we all want to reopen. I think we're all getting a little tired of hanging out at home. But in any case, so what I'd like to do, I'm going to quickly go through just some of the basics of the COVID-19 because frankly, there's a lot of hype, a lot of myths, a lot of misunderstanding, a lot of sort of all kinds of information out there. And so I think it is important to at least start level set a little bit, talk about, what is it exactly, how do we deal with it? And that, of course, will really lead into, how do we get our businesses going again? Because I think that's something we all want to do, but how do we do that safely? And a lot of that depends on, understanding what that is COVID-19, what it is. This is what it looks like. If you see one of these, don't touch it, stay away from it. This is the virus, this is what it looks like under a lot of magnification. Looks pretty benign, but so, the symptoms, people wonder, how do you know if you have it? These are sort of the symptoms that people have. And you can see there's overlap with the common cold, the flu. On the right is just allergies, which a lot of people have, particularly this time of year in California. But you can see the fever, cough, shortness of breath, those have been kind of the hallmarks of COVID-19. Although there is some overlap and there are some other things that have popped up, but generally those are the most important symptoms. So when we're screening, we're going to talk about that later, those are really key questions. Do you have a fever? And of course we can measure that. And are you coughing? And do you have shortness of breath is really an important feature because generally with a cold or with a flu, you don't have shortness of breath. And then just for, again, all the hype, but the reality is this gives you a quick overview of the various pathogens that we've all had to deal with over the years. And at the bottom, the x-axis, that shows left to right increasing infectivity, or how contagious is a pathogen. And you can see on the far right, measles is extraordinarily contagious. It is up to 15, that's the R-OT number that measures contagiousness. It's very contagious, you catch it from the air. But if you look to the left, the coronavirus is really not that contagious compared to others. It's somewhere within that pink box. And then if you look up on the y-axis on the left, and by the way, that's a logarithmic scale. If you look up toward the top, things like Ebola, bird flu, MERS, Mediterranean virus, those are extraordinarily deadly. And so Ebola is 70% death rate. Bird flu is even higher, but coronavirus is actually fairly low. It's probably a little bit more, maybe 2 to 3 times more deadly than the general flu, but you can see at the bottom there, the flu is about 0.1%. So how do you catch it? That's really the big thing. And again, as we talk about how do you reopen business, this is really the important point, I think, understanding how do you catch it? How is it transmitted? So by and large, it comes from respiratory droplets. And the COVID virus lives in your nose, mostly the nasal passages. It can get down into the lungs, but basically it's in the air that you're breathing in and out is where the virus has the most opportunity to be contagious. And respiratory droplets, are expelled, right? And here's one thing that's interesting. So if you're just breathing normally, the chance of virus particles coming out of you, if you have it, very low. But look at this spectrum: breathing, heavy breathing, talking loudly, singing, coughing, sneezing. Sneezing being the worst. That's when you really are expelling viral particles, right? So I mentioned the R0, and you're all going to be like super experts now. You're going to impress your friends knowing this information. R0 is how contagious it is, and it's generally in the range of 1 to 2, meaning one person can affect 1 or 2 people. So again, remember, measles is like 15 people for every one, so it's not that high. But then there's this K factor. The K factor has to do with clusters. And if you think about it, remember, there have been a lot of clusters caused by one person. So how you're exposed, the amount of time, and then again, think about, so the examples in Washington State, there was a church choir group. One person was infected, but they were singing with each other for several hours, and 53 of them out of the 61 people got infected. Why? Because they were in close proximity and they were singing, laughing, talking loudly. That's what spread it. In Japan, recently, you may have read about this, right? One man visited a bunch of different nightclubs, and he alone infected 80 people. Again, because of proximity, because of how the respiratory virus was expelled and then spread. So the other thing is that there are some people who are not sick, but can spread the virus as well. And that's where we start to get into these issues about, how do we protect each other just in case someone is asymptomatic and is positive. And that's where masking is really important, because the masking limits the respiratory particles that come out of a person. So remember that the masking, we'll come back to that, but the masking does not protect the person wearing the mask. It protects other people from the person wearing the mask. And all it does is just limiting the chance to expel respiratory droplets around. And again, by and large, unless you're really close to someone, like face to face, you're not going to catch it from their breath. It's going to basically go from the person, the virus comes out, and the respiratory droplets settles on something, usually the person, around their face, and then it's the touching contact is what transmits it. So someone has respiratory virus particles, they touch something, you touch it, you're close to them, and then you touch your face, that's how you get it. So again, it's not that you're going to catch it from the air, but normally it's going to be because of contact. And that's what this whole 6 feet of social distancing is about, because that is what keeps that under control. And just quickly, and you probably are aware of this, we continue to have increasing numbers around the world, 5 million people, over 5 million people. Remember, well, you don't remember, you weren't alive, but in 1918, the pandemic, the Spanish flu, basically infected a third of the world's population and killed 50 to 60 million people. We're not anywhere close to that. There's a lot more people now on the earth. But again, it certainly has been caught a lot of attention, but in terms of relative pandemics, it's still pretty low. On the other hand, if you look at this, it's kind of interesting that at least for the month of March and April, the deaths in the United States have really moved up this chart, and now the third leading cause of death just in March and April. So it is significant, but again, we have to kind of keep it in perspective. This is California. This is, gets updated a lot, but you can see that probably the biggest driver right now in California is LA County. You can see the big bubble down there, but the rest of the state actually is doing pretty well in terms of keeping things under control. This is the University of Washington healthcare metrics, the institute that follows healthcare metrics. And this is their predictive model for California. And you can see that solid line is the actual cases. The dashed line is their prediction. And so their model has been very accurate. You can see there's been a plateau. The only reason that it hasn't gone down more is because of LA County. If it wasn't for LA County, this actually line would be going down quite a bit. And then their predictive, 6,800 deaths in California by August. That they're still holding, pretty steady to that. And again, just so you know, males have been more affected in terms of deaths than females, and then that the older age groups are more susceptible. However, it's interesting that, as you get to be 80 to 90, it's actually the death rate goes down, but that's because of this, and that is that by and large, most of the deaths are related to comorbid health conditions. So while there are a few cases here and there, and they make big news, healthy person dies of COVID, those are very rare. Generally speaking, the people that are dying are people that have a lot of other medical illnesses and tend to be already sick when they get the virus. And so you can see it's pretty dramatic. That's the biggest driver. And at the bottom here, just so you know, the I don't know what salmon color, whatever that color is, those are the nursing home, long-term facilities, long-term care facility deaths. And you can see more recently that's sort of kept some of the numbers up because it's been running through nursing homes. But outside of the nursing homes, it's been very relatively quiet for the rest of us. And then this is the county dashboard at the bottom, again, that salmon colored graph, the number of new cases. You can see that it's really leveled off nicely in our county, Santa Clara County, and that's a good thing. You can see that there aren't that many new cases, and on this one, 0 deaths. And I thought you'd be interested in this, that there is quite a difference depending on where you live. And so here's Mountain View. You can see a total of 57 cases with a rate of 70 out of 100,000, which is relatively low, and that's why it's lightly shaded. Then if you look east, you see the dark blue areas. Those are much higher, and that's really San Jose, and particularly East San Jose has had a lot more illnesses than on the west side. So it's a little different everywhere, and that's, by the way, that's why it makes it so hard to draw conclusions from a lot of the reports, like New York City, different places, LA even. It's just a lot depends on the location, the geography, the people, whether they're sheltering properly or not. There's a lot of factors involved, but this is our information. So here at El Camino, these are the number of COVID patients we've had. And you can see that it's nicely gone down, flattened out, and now we're really down to either 0 or 1 case a day in terms of being in the hospital. So it really has tapered off nicely, and which means hopefully for all of us, we can get back to business. That's really the goal of all of this sheltering and bringing that curve down, is so that we can really now start to live our lives again the way we sort of hoped we could. Again, this is our data at El Camino Health. Looking at the number of people, just point out that if you see the total patients positive outpatients, 83, so more of the patients that we have seen that have been positive for COVID-19 actually did not require to be in the hospital, that really they actually were treated at home. So we actually have not had to hospitalize that many people. And then the community mortality rate I mentioned earlier, this is based on epidemiological studies, 0.2 to 0.3% death rate from habit, which means 99.8% of the time people are going to recover satisfactorily. So it's not that deadly in terms of from a medical point of view. But of course, the people that do die, obviously it impacts them, but it is pretty low and not 2 to 3 times higher than the basic flu. I want to hit on testing. I know that's a hot topic, particularly for you all. By and large, we've been mostly testing for the presence of the virus, and that is the PCR test. It's a polymerase chain reaction test. It's very sensitive, very accurate. What it tells you is that you have active virus in you, and again, the test is to test the nasal passages. And now we have the antibody test. The thing about the antibody test is it's hard to interpret it right now. All it tells you is that you have had a virus in you. You have an infection that doesn't tell you when. It doesn't tell if you have immunity. It doesn't tell you if you're still infected or not. So you can still be antibody positive and still be causing contagious to pass it on to somebody else. So really, by and large, it's just mostly used for scientific value right now. That may change in the future as we learn more, but for now, the antibody testing, it's interesting, but it really doesn't tell you very much other than, yes, you were exposed to the virus at some point. There's a ton of these tests I showed. There's a little picture one here. There's over 200 that have flooded the market. Most of them don't work very well, are not very accurate. Only a few really have been approved by the FDA. And so we're going to be looking at that more as time goes on. But at least right now, it doesn't really help us a lot. And by the way, so testing, this is on the Santa Clara County website. These are now all the test stations that are in the county, because I think you're going to have some questions about how to get people tested. The one caveat here is many of these testing stations have some limitation. So right now the county recommends for testing people who obviously are sick, they have symptoms, they should be tested, fever, cough, shortness of breath. People that have been exposed to somebody, particularly in a household, and I'll come back to that, they might want to be tested. And then healthcare workers, those are the recommendations, at least right now. So if you're not one of those people, and you want to be tested for your curiosity, it's still a little tough to get tested. And really, even though there's all these test sites, they all have some limit. Either has to be ordered by a physician, or you have to belong to some, either to Kaiser, or there's some Native American, there's some health areas. But the ones that are the, let's see if you can see them on here. Oh, the M. The M, there's two M's on here, if you can see them. Those are the county mobile test site stations, and those are really right now the only ones where you can actually just walk in, get tested, say I want to be tested, regardless of whether you're sick or not. And so you can highlight on any of those, and they can tell you when they're open and that sort of thing. So what do we do at this point? As you know, we have moved ahead, so Santa Clara County, into kind of phase 2, although it's still fairly limited. You probably are aware that the rest of the state, at least a lot of the state has moved ahead, even to stage 3. But each county sort of gets to decide themselves. And so far, we're still sort of holding back in this county. Any kind of healthcare is fine. That's totally open. But you can see the curbside pickup, outdoor activities are allowed, but there's still some limit, on other businesses like restaurants, bars, gyms, and so forth. And so that continues, to be a challenge. I think that as you see those graphs I showed you, I think the county just wants to see, the health department, that there's some stability in that significant drop, and I think you'll see fairly soon that there will be some further relaxation of that. So the key is prevention. And the more we can prevent it and control it, the more we can get back to business. These are the basic precautions. There's really nothing fancy about this, but basically close contact has to be monitored and controlled, because again, if you're in close proximity to someone, that's how you can catch it. And again, there are people who may have it that aren't sick. So that's why this whole social distancing is in place, because of that. The recommendation is because of, you just don't know. And so as long as you keep that distance, generally you're pretty safe. And then for the person, washing your hands, being meticulous about that, not touching your face, all those things, and then the masking, I already talked about that, and the asymptomatic carriers. I will also just point out gloves. I see people wearing gloves around town. I see them driving in their car with their gloves. That really is not helping anything. All that does is tend to spread the virus around, because generally, so I'm a surgeon, right? So if I do surgery, I wash my hands, I put on gloves, I do the surgery. First thing I do when I'm done, gloves come off in the trash, I wash my hands. That's how you use gloves. But wearing gloves all day, eventually you're going to be touching things you're touching, then you're going to touch your face. It really does not provide any protection and probably makes things worse. And so gloves, maybe in certain circumstances for a specific time may be okay. But in general, when you see people wearing gloves around, that's not really helping anybody or anything. So what about businesses? So here's the couple areas I think we need to think about in terms of business and getting back to business. The space is really important. And two things about the space: keeping it clean and disinfected, and being able to maintain distance between people. Those are really the two critical elements of the space of the business. When you're outside, there's very little chance of catching the virus as long as you're not right face to face to someone, because outside, the air, everything gets dissipated quickly. The big risk is indoors. When you're in a closed space with people, that's where you start to have an increased risk. So that's why it's really important to manage that space. And you can see, I think, if you go to, some of the grocery stores like Whole Foods, which have continued to be open, they have done a lot with their space. They put up plexiglass protection. They have people, separated. That's really important. For workers, you have to think about protecting them from the customers as well as the environment. Again, same thing, keeping people apart. I know that we have done a lot of testing in our health system. In fact, we're testing all of our employees. We're testing actually our doctors too. But because people are concerned about, what about me coming back to work? Am I going to be exposed? They're going to be customers coming in. I don't know them. I don't know their health status. So it really is important, I think, for your workers to feel comfortable and safe, that they have some protection. Having people, that's really the rationale for having customers wear masks inside. Again, outside doesn't make that much difference, but inside any structure, you really want to have the customers, if possible, wear masks, because they're the ones that, again, that protects the workers, your workers, if your customers are wearing a mask. And then vice versa, your customers want to feel safe. And so having the workers, employees wear masks helps the customers feel safe. And then, I mentioned the liability. You may have talked about that already. But trying to meet all of these various conditions and regulations, there is also a liability concern as well. Come back to that. But so what do we do? Okay, if you want to get your business going, what do you do? Well, number one is to really look at your space. Again, make sure that there's a way to keep people apart. And if that means if you don't have enough space for 6 feet, then from each person, which some spaces don't, then there needs to be some barrier, like a plexiglass barrier or something to keep people apart. Because if you can't maintain that 6 feet, and then a barrier comes into play. For workers, I think it will be important to monitor them. And monitoring means checking temperature. Now, you can do that remotely with a temperature gun, and then checking for symptoms. Again, so every person that we see, in the hospital, we check them for temperature, and we check, do you have a cough? Do you, have you been short of breath? Do you have any other symptoms that might suggest that you could be infected? And again, if somebody does, then they go home. I think you just have to be consistent about that. Now, if you can get them tested, that's great. But again, the problem with testing people, asymptomatic people, So let's say if you ask a question, should I have all my workers tested? Well, if they're really not sick, then the value of that is not that great. And here's the reason why, because you can be negative one day and positive the next day. And you may be positive before you actually get sick. And so it doesn't really give you that much assurance. Now, it may be something that your employees, perhaps it would make them feel better. If they were all tested, if you tested a group, at least to get started, I think, that could be okay. But again, just testing all the time, probably not really practical. One of these days in the future, hopefully in a month or two, we learn more about the antibodies and the meaning of them. Perhaps we could use them to test for employees. But at least at the moment, I think still the testing options are fairly limited. But it's certainly something to think about. I will say that for us in healthcare, as our patients now are coming back and getting care, they do appreciate the fact that we have tested everybody that comes in contact with them. But again, that's pretty intimate contact, right, when you're having healthcare. And so I'm not sure, in a business setting that that's really necessary. And then the universal masking, and I think from a business point of view, I know there's already discussion about it. I would think chambers of commerce, I think the U.S. Chamber of Commerce has been talking about probably there's a need for some legislative liability immunity because, it's very difficult. Even if you do everything right, there will be cases that slip through. And it's hard to understand why, how we can sort of expect people to be liable for that. I do know, not that there's anything wrong, with trial attorneys, but I know trial attorneys are gearing up. A lot of information being spread among them around, how do they sort of go after COVID-19 liability. And so there probably does need to be some thinking about that going forward. And so what about ahead? I think as we do enter these other stages, and hopefully it'll be soon, and I think it will in our county, that there will be some resurgence. It's inevitable. For the next 1 to 2 years, we will have more cases. The more we lighten up, there will be more cases. But here's the thing. We have to be really, and I know the county health department is thinking about this, we have to be able to live with the COVID virus and do business at the same time. We have to do that, right? So how do we do it? So one of the things that's essential is that we have to be able to identify people that are positive and contact trace them, make sure we know who they've been in contact with, sequester them, kind of like we did at the very beginning of this, but then sort of gave up on that, but we have to get back to that. Because again, these clusters that happen, they can be controlled if you contact trace and isolate people that have been exposed. And we're probably in this for the next year or two. It's always a little hard to predict. I hate to make predictions, but because we've been so good in the county about holding down the number of infections, we kind of pay a price for that in that we don't have that many people that have had the virus. And there's this thing called herd immunity, right? Where if you have enough people that have already had it, it's like measles. If everyone's had the measles, then the chance of it spreading goes down. And so places like New York City, where so many people, 25, 40% of people have already been exposed and have antibodies, then that really starts to confer some herd immunity. But we don't have that here. And so we're going to continue to have to sort of deal with this going forward. That's kind of the downside of being so good at controlling it. But the thing is, you can't keep that control, forever. And so we are going to have to go forward and just be sure that we can be as, protective as we can. But at the same time, we have to be able to do business. So I think that, the shelter in place, it will continue to lighten up, hopefully sooner than later. because I think we all, like I said, we all want to get back, to a little more of a normal life as much as it can be. It'll never quite be the same, I'm sure, but nonetheless, we need to get our businesses working again. We can't stay like this indefinitely. So I will leave you with this thought, and I think it says a lot about where we've been, where we're going with this. If we begin with certainties, we'll end in doubts. But if we begin with doubts, like we have, and we're patient with them, work through them, we'll end up with certainties. Right? And I think we've learned a lot in these last 2 months, and I think we have to use that knowledge to move forward. We can't stand still. So anyway, I hope that helped somewhat. By the way, at the end, I did forward this PowerPoint, and you're welcome to have it or share it. At the end, I did put in, there are some references that I think are really good for reopening business, but I'm happy to answer questions in the meantime.
Okay. All right, well, we do have one question from one of our participants today, and sorry about the, apologize, but anyway, the question is, what is your current understanding about the risk of transmitting COVID on surfaces such as plastic? That's the first part.
Can you repeat that?
What is your current understanding about the risk of transmitting COVID-19 on surfaces such as plastic or cardboard, the packaged goods that we interface with?
Yeah, there's conflicting evidence about that. It is possible the respiratory droplets can survive on some surfaces for a period of time, but it's fairly limited. It's possible it's possible to detect the viral particles for hours, but those are not active viruses that can affect you. So what I would say is basically surfaces that are touched a lot. A good example, doorknobs, elevator buttons, keypads, those should be cleaned regularly because it is possible to transmit that way from one person touching and another person touching. And so that is important. But in terms of like a cardboard box, that gets delivered, that's not going to infect anybody. The time has to be pretty proximate, and the viral load has to be significant to really do it, to catch it that way. But those surfaces that are used over and over, like I said, those really should be cleaned frequently, disinfected frequently.
Okay. All right. Well, thank you for that. And then we have another question. Mitch can't wait to jump in a pool and cool off. Are there any risks associated with sharing a pool, so long as everyone keeps their distance?
Yeah, there's no evidence of water transmission, and so and even better in a chlorinated pool, that's really very unlikely. So unless you're in close contact with somebody, just being in the pool that someone else has been in is not going to be an issue.
Okay, so the distance is still critical. Mitch wanted to add that he was born at El Camino Hospital, and your amazing staff also saved his dad's life. So he thanks you very much, you and your staff, for that.
Oh, well, thank you. We're happy to do that.
Yeah. That's what I have for questions from the audience right now. And I know that we also had some questions about getting back to business and what business needs to have on hand. And so do you feel, or are you recommending that businesses should have all of their employees tested before they reopen?
I don't really recommend that. Again, I don't know that really gives you that much information. So I would say this: if I would, definitely screen for symptoms and fever. And by the way, 100.4 or above is considered a fever. Anything less is fine. Contact with COVID positive people, that's really important. So a lot of the cases we've seen in this county, and the reason why there's so many in East San Jose is because of people living in households with infected people in close contact. So if an employee has a history like that, then definitely I would say it's worth getting tested. But in terms of just wholesale testing, I'm not sure there's a lot of benefit for that, at least right now.
Dr. Adams, can you hear me? Great. So my question has to do with getting businesses back working again. And you mentioned disinfecting surfaces. And one of the things that a lot of businesses are curious about is just what does that mean? Meaning, should I get out the industrial strength cleaner that kills everything within a 5-mile radius? Or is it, a regular Clorox spray or whatever? And also, when you talk about, cleaning a surface regularly, does that mean every time anybody touches anything? Does that mean every 10 minutes, once a day? What does frequency mean?
Yeah, I would say, well, first of all, you don't have to go like a flea bomb route where you do the whole place. But I would say I would focus on areas where people are in contact with the surface. And those areas, I think, should be wiped. It's just a quick wipe. Standard disinfectant, whether it's bleach or whatever. It has to dry to work, so it does have to dry. So something, there are wipes that are a quick dry, but I think a quick wipe of the surface that people are in contact with a lot really is the most important part of it. I think in terms of, I think having to sort of disinfect an entire space is not really necessary. It's really those surfaces where people are in contact. Like I said, keypad, I think you'll see maybe like for credit card keypads, what I've seen is either you wipe it, briefly in between use. Another thing that people have been doing, I think is good, is they have little plastic stylets, a bucket of them, and that each customer can have their own stylet then to touch the keypad. That's another, sort of approach I've seen. I mean, I think all that, makes sense, but it doesn't have to be, sort of a complete overhaul every time.
So kind of related to that is, if you as a health professional were to walk into a business and the business is interested in kind of getting your seal of approval, if you will, understanding that everything could change 2 hours later if a whole crowd of 50 people went in there and coughed on everything. But if you were to give a seal of approval, what kind of things would you be looking for them to have done?
So I would say, again, just being able to disinfect, at least on a fairly routine basis makes sense. But I would say the biggest, for me, understanding the science of it, it's how you manage the people interactions. That is really the key. And I think if you look at some of the, I'll use them again, Whole Foods, for example, they have done a great job. They keep people apart. They limit, the progression of people going into the store. They have, protect their employees, with some plexiglass. And I think, to me, that's what, as a customer, what matters is that the business is really making an effort to manage the people. Really, to me, is more important than anything else. And I know that that's been tough in some instances. There's been controversies, not so much here, I don't think. I think people generally are pretty well behaved here, but you see in other places in the country where people are fighting and arguing. They don't want to be kept apart. They don't want to wear a mask. They don't want to do this. They don't want to do that. And the business owner often is the arbiter that has to sort of referee that. But I think in the Costco example, right, where the person told the customer to leave if they didn't wear a mask, to me, that tells me as a customer that, okay, that there's an effort being made to keep everybody safe.
Thank you.
Okay, it looks like we have a question from one of our attendees. They would like to know, what about using a medical grade ultraviolet blue light system to help with disinfecting our office space?
Yeah, it works. It does work. Ultraviolet does kill the virus. And so I think that is, we use ultraviolet in the hospital, to kill, actually it's not so much, well, it can be used for this virus, but actually for some other infectious agents that are even more resistant, we use for that. But it can be very effective. Putting devices, and that's the other thing, that probably, one of the dirtiest items that we all have are our phones. Phones, lots of studies have been done that phones collect all kinds of germs during the course of a day. And so things like that could be put in an ultraviolet box, disinfected. So that, yeah, that works.
Oh, good to know. Okay. All right. Thank you for that. That's what I have from our attendees right now. Peter, do you have any other questions?
I have one other one in terms of the testing facilities themselves. You mentioned, of course, the mobile unit, and I think it was just there Monday and today. I don't know if it's now on its way to another mobile location. Do you happen to know if any more permanent facilities are going to be set up?
They are. We're actually right now preparing to set up something in Mountain View with cooperation with the El Camino Hospital District. We have the there's the El Camino Health, but then there's the district. And the district has allocated some dollars for testing. And so we are in the process, hopefully very soon, setting up in cooperation with the district to help the El Camino District Board and setting up testing. So that should be coming soon. And that would be testing for anybody. So you would not need to have a doctor order or whatever, just get tested. And I think that could be an answer, particularly for businesses that feel like they do want to test their employees. That would be a great solution. So that's coming soon.
Great. Thank you.
Does El Camino have testing for available? I think I saw that testing available. Somebody has to first.
Yeah, we do. We do have internal testing capability, but it's still, the quantity is limited. And so we basically use that mostly for our patients and our staff and physicians. And so we would like to broaden that, but as you know, testing, has been fairly limited across the country. But we do have the ability to do it. So it's a rapid test that we can do in about 45 minutes inside the hospital. But again, we don't have enough quantity of reagents to test on a mass basis.
So for the test that you have, within 45 minutes, I can know the answer?
Yes. Mm-hmm.
Oh, okay.
Yeah, it's made by a company in Sunnyvale called Cepheid. And so, yeah, they've been really helpful with us to getting our testing in our lab.
Okay, that's great information. And you must be doing an awesome job with your explanation, because we don't have so many questions from our participants today. And I know that it's really nice to have this information from you, because it's hard to tell the information that we're getting on the news. Sometimes it's contradictory and you really don't know what it is to believe. And I think that must be very confusing for business owners.
Yeah, and I sympathize with that. I do. And you have my email, and if somebody wants to email me a question, I'll do my best to answer it for them.
Dr. Adams, one last thing that I do want to ask, and this has come up from a variety of sources, is that some people have likened the pockets of behavior and all that to kind of like being in the non-smoking section of an airplane many years ago. And that, just putting up a wall and saying, this is the non-smoking and this is the smoking, or these are open for business, these aren't, or whatever, isn't really relevant, especially in such a mobile area as we are in the Bay Area. So when we hear about, other counties or other areas that are lessening their restrictions, are we in danger in our area because we're being stricter?
That's a great question. And I honestly thought a lot about that too, because, ultimately, we asked the question, why did we here in Silicon Valley get some of the first cases in the country? And the answer is because people travel so much here, right? People are constantly traveling in and out of this county, going to other countries. And I think that's what really got us started early on. And so eventually, people will start traveling more. And you're exactly right. So what we do, that's why us hunkering down here, is good for us for now. And that's why I was saying we're going to have to learn to live with the virus and also do business, because that will inevitably, people will start to come and go. And you're right that in some places, there could be higher risk. And so with that in turn would expose us to that same sort of risk. So yeah, it's like secondhand smoke, right? I mean, you may not be a smoker, but you're going to be, around somebody who does. And so I think that's exactly right. And that's why we have to be able to handle, a future surge, because inevitably there probably will be some increase in the cases because of that. I will say one thing. I don't know if amuse is the right word, but I have to say some of the people who have been protesting wearing a mask, I think they don't understand the mask is not for them. The mask is to protect other people. And so people saying, well, it's my right, to do whatever, I want. It's not about you. It's about other people. Clearly there's some disconnect, around that, because it's really to protect other people, not to protect yourself.
Thank you, Dr. Adams. It looks like we have a raised hand from Jerry. So Jerry, I'm going to allow you to talk, and then you'll need to unmute yourself. So I'm going to allow you to talk. There we go. Go ahead and unmute yourself. I'll unmute you.
Am I unmuted now?
Yeah, I just unmuted you.
Oh, okay. I really didn't have a question. I was just shooting around while I was listening, and I clicked on the question. I enjoyed the presentation, though. It's very good.
Thank you, Jerry.
Can we let Matt chat for a second, because he seems to have a document that might be helpful for business?
Yeah, Matt, I'm going to go ahead and unmute you. Give me 1 second.
Can you hear me?
Hi, Matt. Yes.
Hello. Great. So Kaiser Permanente also has a playbook for return to work, and I'll include a link to an article on that, which includes a link to the playbook itself. I'm not the type to want to toot our own horn, so I'll give it through a third party so you can see that somebody else reviewed it, not just me. But it is a Kaiser Permanente document about health and having folks return to work. So I will put that in the chat in just a moment here, and happy to answer any questions on that.
Great. Thank you, Matt.
Sure.
I'm going to go ahead and do that.
I did. I guess on a lighter note, if I can, and you'll have these too, but a lot of interest in sports, right? That people are worried that you can't play football, you can't play soccer, you can't come in contact with people. But I did find this, that the perfect sport for COVID actually turns out to be fencing, right? Because you get to wear a mask, you wear gloves, and if anybody gets close to you, you can stick them. So.
That's fun.
That is. Well, thank you so much, Dr. Mark Adams, for being here with us today. We really appreciate your expertise on this. It's always the front of our minds right now. I think I can speak for everyone when I say that. But again, we really appreciate you being here. Thank you everyone for joining us today. This was our second week of our Back to Business series.
Okay, well, great. Well, thanks for inviting me. It's my pleasure. Like I said, I'm happy to help anytime. Everybody wants to get back to work for sure.
Definitely. Well, thank you for all of your help. I think this really helps us understand what's going on and how we can prepare for a healthy reopening. Just so everyone knows, I know there was a little trouble for some people logging in. There will be a recording that's sent out. There will be a recording along with links that were mentioned in this presentation. So all of that information will get to you, and we will all be able to move towards a happy and healthy Mountain View. Thank you everyone for joining us. Thank you again, Dr. Adams, and hope you all have a great and healthy day. Wash your hands.